Have you ever felt that sudden pit in your stomach when you realize your family's healthcare coverage might just vanish? It is a stressful thought, right? Well, welcome to this explainer. Today, we're going to walk you through the South Carolina Medicaid renewal process step by step. Navigating government systems can honestly feel like a maze, but we're going to break it down into a clear, visual roadmap so you don't lose your coverage. Look, if you're sitting there feeling anxious about losing your benefits, you are absolutely not alone. It's incredibly relatable. You rely on these benefits, and missing a deadline can actually end your coverage, even if your income hasn't changed and you still qualify. Literally, just missing a piece of paper can cause it. But don't worry, we've got a really straightforward online solution right here to relieve that paperwork anxiety. You'll see exactly what to click, what to upload, and what traps to watch out for.
Okay, here's our roadmap for today. 1. Medicaid renewal basics. 2. Eligibility and preparation. 3. The step-by-step online process. 4. Common issues and solutions. And finally, 5. Finalizing and resources. Let's jump right in.
Section 1. Medicaid Renewal Basics. Why renewing on time matters.
So, federal law dictates that Medicaid eligibility has to be reviewed every single year. Now, the state will try to verify your info automatically, but when that fails, they send you a renewal packet. And the second that packet hits your mailbox or inbox, the clock starts ticking. This really highlights why you've got to pay attention to those deadlines. See, there are 2 ways to lose your Medicaid. The first is an eligibility-based termination. That makes sense, right? Your income went up, circumstances changed, and you just don't qualify anymore. But that second one, procedural termination, that's what we're fighting against today. That means you lost your health coverage simply because you missed a piece of mail, didn't sign a form, or missed a deadline, even though you totally still qualify. We do not want a procedural termination taking away your benefits.
Section 2. Eligibility and preparation. Getting ready to renew. To avoid that procedural trap, preparation is absolutely key. Prepping in advance turns what could be a frustrating hour at the computer into a really smooth 10-minute task. Let's do a quick refresher on who typically needs to do this. Healthy Connections Medicaid eligibility is usually based on income and assets, and it covers a really wide range of folks across South Carolina. We're talking children, parents and caretakers, pregnant women, folks over 65, people living with disabilities, and individuals in specific health programs like breast and cervical cancer patients. If you fall into these categories, this annual review is your ticket to keeping that continuous care. Before you even sit down at your computer or pick up the phone, you'll want to have these specific details ready to go. You'll need the primary contact's social security number and date of birth. Make sure you know your exact gross pay amounts, that's the money you make before taxes are taken out, and how often you get paid. If you receive pensions, unemployment, rental income, or alimony, grab those numbers too. And if you're in a long-term care program, you'll need current balances for your assets, like checking accounts or vehicles. Having all this stacked neatly on your desk is going to make the online portal an absolute breeze. Section 3. Step-by-step online process. Navigating the portal. Okay, let's break the first 4 steps down. If you're a first-time user, step 1 is visiting apply.scdhs.gov to create your secure account and selecting Submit Annual Review. Pro tip here, definitely save your new login info in a secure password manager or a safe spot at home so you aren't scrambling for it next year. Step 2 is verifying your identity using the primary contact's social security number, name, and date of birth. Now, step 3 is vital. You have to review the household list the state currently has on file. If someone left, check moved out. If you had a baby or someone moved in, click new household member. Finally, step 4 is where you'll punch in those employer and gross pay details we just had you gather up. Now, I need you to pay super close attention here because this is a bit of a hidden trap. In the portal workflow, usually around question 8, it asks, do you wish to continue receiving Medicaid services? It seems like a total no-brainer, right? I mean, why else would you be logging in? But here's the catch with the state system. If you accidentally bypass this question or mistakenly click no, the system automatically marks your case for closure. It literally doesn't matter if your income perfectly qualifies you. You must definitively answer this question to protect your case. So rounding out our portal steps, step 5 is answering a big yes to that critical question. Step 6 is for folks in non-MAGI or long-term care programs. You'll need to input the current values for assets like savings accounts or vehicles here. And finally, step 7, you have to read the legal declarations and apply your electronic signature. Listen, if you just close the browser without formally submitting and electronically signing, the state can't process it, and boom, it triggers an automated procedural closure. Hit sign, hit submit, and wait for that confirmation screen. Section 4. Common issues and solutions. Troubleshooting. Even with the best preparation, tech glitches happen, or maybe your situation is just more complicated than a simple drop-down menu allows. But you are never alone in this. If you aren't getting your renewal mail in the first place, the state probably just has a bad address for you. You can update your contact info directly at apply.scdhs.gov without even doing a full review. Having sign-in difficulties? The state uses ID.me for secure identity verification, which is pretty standard across government sites nowadays. And if you get completely stuck on a step, please don't guess. Just call the Healthy Connections line at 888-549-0820. A real human can actually help you complete the renewal right there over the phone. Section 5. Finalizing and resources after you submit. Once you hit Submit online, you'll get a confirmation, and eventually, the state sends you a notice detailing whether your coverage has been renewed. But what if life just got in the way? The deadline flew by, and you suddenly realize your coverage has been shut off. Are you just out of luck for the whole year? The answer is no, thanks to this number right here, 90. This is an incredible lifeline that frankly not enough people know about. You actually have a 90-day reconsideration window in South Carolina. If you miss your paperwork deadline and your coverage gets procedurally terminated, you have 90 days from the date of closure to submit your renewal form. If the state processes it and finds you're still eligible, they will reinstate your coverage and can even retroactively cover the medical bills you racked up during that gap. So whatever you do, don't give up just because you missed the initial deadline. Beyond the state helpline, there are some really phenomenal community resources out there. If you need a human touch or you're facing a really complex situation, groups like the Palmetto Project offer completely free appointments to help you navigate this. You can reach them at 888-998-4646. Your local county eligibility office is also always there for in-person assistance, where staff can hand you forms directly. Now, if you find out you actually make too much money for Medicaid now, head immediately to healthcare.gov to secure a subsidized plan so you don't experience a gap in coverage. The state also offers some great how-to videos on their site if you need visual help making your account. Just a quick heads up, while this explainer provides a comprehensive guide based on data as of July 26, 2026, government systems and rules can and do evolve. Always verify the most current procedures, income limits, and rules directly with South Carolina state authorities or on official websites like scdhs.gov. Healthcare is the foundation of your family's well-being. Don't wait. Log on to apply.scdhs.gov, gather those documents up, and take that vital step to protect your health and your peace of mind today. But it really begs a larger question, doesn't it? How many of our neighbors are currently risking their health simply because they're intimidated by a confusing web portal? Please share this explainer with someone in your community who might need it, because knowing how the system works is the absolute first step to beating it.